So I just wanted to review the medications that we use during a food challenge in the event that the child has a reaction and we need to administer medications to get the reaction under control. When our patients come in, we do height and weight, and all the medications for the challenges are based on their height and weight. That means that sometimes kids will come in and they'll have a different dose of their epinephrine than what you might have had at home. So sometimes the epinephrine is given at certain weights, and they may have reached a new threshold, and we'll bump them up to the next dose of epinephrine. So I just wanted to mention that because sometimes that's a change for parents. The epinephrine comes in two strengths. It's EpiPen Junior, which is 0.15 milligrams. This is the auto-injectable epinephrine, the same one that we prescribe for our patients at home, or the EpiPen 0.3 milligram. This is also the same as what people have at home. We prefer to use the EpiPens during our food challenges because it is what people use at home. And it's often the opportunity when we do have a failed food challenge for the patient to see how an EpiPen is given. A lot of our patients have never had to use an EpiPen, so at least they have this experience of coming in and although the child has failed the challenge, they've learned how to use an EpiPen and how quickly the child responded to an EpiPen. As a general rule, EpiPen Junior is given to kids under 50 pounds here, and the EpiPen 0.3 milligrams is given to kids over 50 pounds. So that's how we prescribe here in the clinic setting. Then in the category of antihistamines, we use two different antihistamines. One is Benadryl, and that is based on the weight, and then Zyrtec, which we also base on weight. And it's really up to the physician who is monitoring the food challenge which medication they're going to use, whether they're going to use the Benadryl or the Zyrtec. Benadryl is a little more sedating, but it's quicker acting, and the Zyrtec is non-sedating, but it is a little slower to start to work. When kids have had a reaction, sometimes they'll have the antihistamine, even the epinephrine, and they may still be uncomfortable with hives. And in that case, if the hives haven't resolved, then we'll go ahead and give ranitidine. Ranitidine is also in the class of antihistamine. It's called an H2. And what it does is it potentiates the other antihistamines, and it's like an adjunct to the antihistamines. And sometimes when we add this in, the hives will resolve faster by adding in the ranitidine. And then the last most common medicine we use is the Orapred or prednisolone, and that's an oral steroid. And we use this in kids who've had respiratory symptoms during a challenge, and it looks like maybe they're going to need to be on this for either 1 to 3, sometimes even 5 days after a challenge in case they've had a bigger reaction and they have an asthma component, and we want to keep that under control. And so as a precaution, after they leave, they're going to be on Orapred. And we usually give the first dose here in the clinic. We have additional medications that we do use, but these are the most common ones. And so those were the ones that I wanted to just review today.